Firstly, diabetes is always at the back of your mind. I'm a type 1, so that I can't do anything without, checking, or it gets exhausting. Always having to test. The planning of it can be straining somehow.
The physical effects of diabetes are well documented. But why are people living with diabetes more likely to develop mental health frailties?
With any chronic illness, you can think about the fact that one has to change their lifestyle. So it can be anxiety provoking, especially if people are not made aware of what diabetes is, what to expect, and the type of treatment they will be given. So they are more likely anybody would be likely to be anxious about what the journey would entail. For some other people, they might have a sense of being overwhelmed, just having to consistently take medication, and as it can actually have mental fatigue on a patient or on a person. So those are the things that one could experience. I think anxiety in terms of, am I going to live, depending on the situation or the time when they are diagnosed with diabetes. So anxiety, fear is something that we see when somebody is diagnosed with chronic illness, and just unsureness about their future. Diabetes is more related with fluctuations of sugar, as you know. And with rapid changes in terms of sugar, it actually also affects mood changes, and that is why we are more likely to see changes in mood with people that have diabetes. One of the things that we also see amongst people that are diagnosed with diabetes is what we call diabetes distress. The symptoms related to distress that we see are similar to some of the symptoms that we see amongst patients or clients that have anxiety disorders, depression, as well as other mood disorders.
COVID and diabetes, it's like a difference. Diabetes, it's you have to look out for yourself. But with COVID, the next person has to also care for you. I mean, I guess all of us hear the same thing. COVID, you never know. As a diabetic, you are at a risk. It's really scary.
Diabetes can be overwhelming both physically and mentally. How can people living with diabetes cope with mental health issues?
One of the things that I would highly recommend is that when they see changes in terms of mood, they should talk to the healthcare provider, talk about their feelings, talk about the changes, whether it's physical changes and mood changes. They should also talk to their family members, talk about what is happening, what they're thinking, and if it is possible, go and seek professional help in terms of mental health services. The other thing that can actually help to address mood changes amongst people with diabetes is actually engaging in physical activities, just so that it also changes their mood. Eating healthy, obviously, I think physicians will tell you that also affects the mood changes, and it can stabilize those mood changes. But with regards to mental health, I would say seek psychological help.